Matters Health now. Faith-based healthcare providers in the country have issued a 14-day ultimatum to the government to clear outstanding debts owed to them by the defunct National Health Insurance Fund, NHIF. The health facilities want 10 billion shillings owed to them by Social Health Authority and Medical Administrators Kenya Limited, which serves teachers and police officers, paid, failure to which they will withdraw their services. This as the Rural and Urban Private Hospitals Association of Kenya lifted the suspension of services offered under SHA following the move by President William Ruto directing the payment of NHIF claims for facilities owed 10 million shillings and below. Safina Chengoma reports.
The Kenya faith-based health services providers are issuing a 14-day ultimatum demanding for immediate payment of outstanding NHIF, SHA and Makel debts totaling to 10 billion.
The latest threat by the faith-based health service providers comes as a big blow to the government, coming at the center of a financial crisis which is crippling the health sector. According to the religious leaders, the facilities are owed about 6.8 billion shillings by the defunct National Health Insurance Fund, 2.2 billion shillings by the Social Health Authority, and 1 billion shillings by the Medical Administrators Kenya Limited, MAKL, which serves teachers and police officers.
The faith-based leaders have reached a painful decision, since we cannot afford to take in more debt after numerous engagements with the Ministry of Health, SHA, and all necessary government leaders.
Hospitals are unable to get adequate help from SHA regional offices. They seem not to have been trained or empowered to make any decisions. They always refer all questions and support requests to the system developer, who appears to be outside of SHA, unreachable and with all authority.
The service providers, comprising about 1,300 health facilities, have decried the financial distress occasioned by the delay.
The situation is very dire because we are unable to pay staff salaries, suppliers, and cater for other operational expenses necessary for providing the healthcare services to the deserving communities.
If the government has no money, let them tell us we have no money, and tell the Kenyans we have no money, and call a spade, we don't have money. Dear Kenyans, pay out of your pocket and save us the agony.
Their threat coming on a day when their counterparts from the Rural and Urban Private Hospitals Association of Kenya, RUFA, lifted the suspension of health services funded under SHA. This is after President William Ruto directed the payment of NHIF arrears.
The directive by His Excellency the President to pay claims below Kenya shillings 10 million in full provides immediate relief to 88% of our providers. By our estimate, that is roughly 2,986 healthcare facilities. Many of these facilities are level 2, 3, and 4 hospitals that serve the large proportion of Kenyans, and their financial stabilization is crucial to maintaining uninterrupted service delivery.
RUFA has, however, demanded that the payment of NHIF arrears be done within the next 7 days, failure to which they will resume their boycott. According to the directive by the President, hospitals owed 10 million shillings and above by the defunct NHIF will be paid upon completion of a verification exercise, which is to be conducted within 90 days.
The ones left unpaid handle the more complicated diseases, specialized surgeries, critical patients, which are costly and life-saving.
If there is a cap of Kenya shillings 10 million, our point is that these facilities should be paid up to 10 million shillings while they await for this verification.
Health services funded under MAKL, which benefits mostly teachers and police officers, will remain suspended in private hospitals until their arrears are paid. Safina Chengoma, Citizen TV.